Hello and welcome to this edition of Startup Central. I'm Nayantara Rai. This is the only show of its kind on Indian television dedicated, of course, to startups, innovation, technology, entrepreneurship, disruption. Basically, if it falls under the gambit of the new economy, it's here every weekday on your favorite channel, ET Now, at sharp 6 p.m. Ladies and gentlemen, like all the stakeholders of the community that we get on this very show, Team Startup Central thrives on constructive criticism. We want to hear more from you on how we can improve the show, take it to the next level. Keep writing in. We love your emails. suc@etnow.tv is our email address. It must be pointed out that as India fights one of its fiercest battles, this time it's against a pandemic, the startup community has certainly come together to fight as we scramble for resources, be it oxygen concentrators, medication, how to find plasma, where hospital beds might be vacant. We've seen a lot of innovation on that front from the startup community. What we've also seen is, these are very encouraging signs of the startup community willing to give it back monetarily. They're doing it in very different ways. They're joining hands, coming out with innovation, whether on some of the toolkits like I was pointing out, just so that we can all find resources. Many are resorting to chartering flights for oxygen concentrators. Some are talking about large vaccination drives which could be at cost. Others are giving checks, donating from their personal wealth. And some of these people we are pointing out today on who are, all of them who are doing so. Vijay Shekhar Sharma, the founder of India's most valuable startup and Decacorn PTM, is one of them who has raised 2 crores to source 10,000 oxygen generators. Then you got ACT Grants. ACT Grants was actually set up at the start of the pandemic by stalwarts of the startup community. I'm talking about founders, I'm talking about venture capitalists who came together. They have actually opened up for people like you and me also now to donate. They're accepting donations anything between 5,000 and 50 lakhs. This is all to import oxygen concentrators. It is to donate oxygen. It is to help fund beds. It is to help connect people who need plasma donations and all of that. You've got Delivery. Delivery, in fact, has chartered flights with oxygen concentrators. Sahil Barua, the founder, took to LinkedIn to talk about this. Ashish Sehgal, who started CoinSwitch and was in fact on the show just last week after getting a big check from Tiger Global, has personally pledged $1 million. These are just some of them who are doing so. Through the course of this week, we will highlight many more instances. Today, we also get to an interview with India's only health tech unicorn, Pharmeasy. What we've seen in the last couple of days are companies, startups, unicorns come together for India's fight against coronavirus, whether it is to charter planes for oxygen concentrators or to come out with vaccination programs. Today on the show, we have a health tech unicorn. In fact, it's India's only health tech unicorn, Pharmeasy, which has come out with an initiative and what it wants to do so that India can vaccinate everybody. Joining me, the co-founder, Dhaval. Dhaval, thank you so much for joining us here on Startup Central. Tell us, what is it that you're doing? I understand your ambitions are, to have a mass-scale vaccination drive.
Yes, thank you so much for having me here. You're absolutely right. I think this is the right time for all of us to come together in this fight against COVID. As a part of that, I think we've launched officially registering people for the vaccination drive that we will undertake in starting the month of May. I think the efforts of the government have now played out. I think there will be stock that will be made available to all private players, including our hospital partners. We have a network of 30 plus warehouses, 45,000 plus retail stores across the country. So we have a widespread network. We can use our access and our reach to reach every corner of the country and make the vaccination available. That's the plan.
I understand your plan is that you want to vaccinate as many as 3 crore Indians in the next couple of months. But Dhaval, I've got to ask you this question. Where are the vaccines? How is this going to be done?
So I think that's something that is in the works, right? So right now we just have 2 vaccines which are currently live in India. We have Covishield and Covaxin. From what we hear, there have been multiple discussions between the government and the manufacturers of these two vaccines on ramping up capacity as well. We've also been told that the government has, on a war footing, set up the process for validating Pfizer, Moderna, as well as the Johnson & Johnson vaccine. Even Sputnik, we hear, will be made available very, very soon. So I think the current shortage that we see has been because of manufacturing constraints. But if I, hear it and from whatever we've been told, I think the supply will ease up over the next 4 to 5 weeks, is what we've been told.
And this cannot be a corporate social responsibility, or is this a corporate social responsibility? Are you doing this as CSR? What is the idea? Like, are you going to make money out of this?
So the idea has never been to make money out of anything that is related to COVID, and I don't think anybody in the country is actually wanting to do that. I think what everybody needs to take into consideration is that there will be cost attached to the entire process, right? In terms of registration, the entire infrastructure, partner hospitals, the administrators, maintaining cold chain. I think that those costs will have to be recovered. There's no intent of making profit, and this is the last thing that companies like ours would want to do in these tough times, wherein we would love to do whatever we can in order to make this drive a massive success.
So, you talked to me about the 350 warehouses that you have. You have a retail partnership network of about 80,000 people. You've got about 5,000 doctors on your network as well. What is the plan? Are you going to go into the smaller cities? Are you going to focus in the big cities? Are you tying up with corporates? Are you going to tie up with condo complexes and RWAs? Can you tell us a little bit about this?
Sure. So let's just split this into two parts. One is the entire supply chain. So when you mention about our warehouses, our retail stores, our supply chain, we can get the vaccines delivered to all 19,000 habitable zip codes in India. So our supply chain is completely enabled, readily available for the government and for us to take advantage of in these times. Number two is the entire administration, right? And that's where it becomes tricky, and that's where we will need partners, on-ground execution partners. So that's where our network of doctors, clinics, hospitals, we will reach out to as many healthcare providers as we can, who can, use our supply chain in order to get the administration done. It will be impossible for anybody to be setting up, say, a center in every pin code in India. And that's where partners like private hospitals, nursing homes, clinics, are the ones that we will tie up with, and we will be administering vaccines to them.
Have you already been in touch with Serum or Bharat Biotech for the Indian vaccines, or are you waiting for some time? Are you also started talking to the Pfizers and the Modernas of the world?
So we are already talking to almost all the manufacturers out there. As we said, it's going to see more than getting supply. I think preparing for the entire supply chain is going to take some time. So, for example, Pfizer needs minus 40 degree temperature supply chain systems. Sputnik will need minus 18. Sputnik is 2 different doses. The entire administration process is going to be a bit different. So, we are talking to every single manufacturer out there, trying to understand the intricacies of their program or their product, which will help us plan better. In terms of supply, we know that Covishield and Covaxin will be made available much earlier. So, obviously, we will start with them. But we are absolutely open to partnering with all the vaccine manufacturers out there in order to get as many vaccinations done at the earliest.
I believe you've already started registrations. Can you tell us the kind of response that you have seen? And secondly, how are you registering all of them? Because are they not supposed to be registered on CoWIN? CoWIN will, of course, go live from 28th of April for those age below 45 and above 18.
Oh, definitely. No. So let me clarify. I think and a lot of people have been asking us this. So the registration that we've started is more just to get a sense of the demand out there, the number of people who can provide us facilities, who are open to getting outsiders into their campus, can we set up permanent facilities in some campuses, or can we set up mobile facilities in a few? So, this is more to understand the demand. This is not any official registration that is, as an alternative to the COVID registration, not at all. So the idea is to just get demand sorted, and it's been crazy, right? I mean, we've got inbound from almost 80 to 90% of the top, people who have more than 15 to 20,000 people in their organizations, top startups of India, banks. I think everybody is wanting to play their role, and we are so glad that we are hearing back from them. A lot of companies have offered us their campuses. A lot of startups have offered us help on logistics, supply chain. And I think we are trying to get all of this together and put it out as a single program that can work effectively and get the job done.
So now, when you look at Bharat Biotech and you also look at Serum, for the non-government channel, the pricing is going to be around 1,200 rupees. You're saying that there will be other costs that you will need to undertake. Can you give an idea of how much it's going to cost, or is it too early?
Very honestly, it's a bit too early. The cost will not be outrageous. Even after everything baked in, I think the Indian vaccination program will be the cheapest across the world, even in private setups. So I think that's something that we can definitely assure. We are working across partners. As we said, the vaccines which require more temperature control will be a bit difficult and might turn out to be a bit more expensive. But other than those, I think we are very confident that they will be very, very affordable, and we should be able to give out the details very, very soon.
Since I have you on the show today, Dhaval, I'd also like to ask you that, at a time when, you're seeing big cities and other reports coming in of how smaller cities like Dehradun are also suffering. I'm talking about the lack of oxygen, the oxygen supply problems that we're seeing. Anything that Pharmeasy is doing on that front? There are a lot of startups that are looking to join hands to battle this new crisis.
So absolutely, I think over the last few days, our supply chain capabilities have been tested to the limit. I think we are currently operating at 250% of our capacities right now, and with a team which is almost 70 to 80% live, because 15 to 20% of our team is down as well with COVID. So it's been crazy. I think the coordination that is required currently in just procuring everything that is needed in terms of pharmaceutical products and also other COVID care products and services is extremely crazy out there. So we are trying to procure as many products that can be delivered to every single pin code in India and ensuring that our supply chain holds true. Let's just hope, fingers crossed, that we are able to do justice to all the people who are putting faith in us by placing orders with us even in these tough times.
You're working at overcapacity the last couple of days when we started seeing the numbers really balloon. What kind of traffic have you seen at Pharmeasy? Because, it's in the bigger cities now, you have certain mini lockdowns. It's scary to go to pharmacies. You can't, pharmacists are not even coming on the phone.
Yeah, so currently we are really pushing our teams to work 24/7. Our warehouses are now, our partner warehouses are operating round the clock. Our partner delivery boys are working overtime. Our retail partners are working 7 days, 365 days as of now. The volumes are as high as 250% of what we were doing just 2 weeks back. So I think the demand has really, really shot. And there are products that are running on lower, shortage, manufacturing, logistics have been hampered, manufacturing has been hampered. So it's tough right now, but I think we are doing all it takes to get every single patient the medicines that they need in every corner of India.
And with that, Dhaval, I'd like to thank you for taking the time out. I know it's a crazy time for you. We really appreciate it. That's Pharmeasy doing all it can in India's fight against coronavirus.
Thank you. Thank you so much for having me here. Stay safe, everybody. Thank you.
Thank you so much, Dhaval. Thank you so much.